The Gauteng Department of Health has today unveiled a multisectoral implementation plan to tackle the pandemic of teenage pregnancy in the province. The plan outlines a set of objectives with specific timelines that reflect the commitment to address pregnancy among the youth. Joining us to discuss this further is Marousi Mzondi, Deputy Director of Gauteng Health's Integrated School Health Program. Ms. Mzondi, good afternoon and thank you very much for your time. So you've unveiled your multisectoral intervention plan to address teenage pregnancy. But before we unpack the plan, I want us to discuss the worrying stats that prompted government to put together such a plan. What do the stats actually show around pregnancy and termination among teens in the province?
Okay, thank you very much. Yes, for the previous years, we have been having a rise in teenage deliveries in our institutions, and that's why the department saw the importance of holding this strategic workshop or this implementation plan, where we met together with the young people, together with our supporting partners who are supporting us in reducing these teenage pregnancies. We also met with faith-based organizations and then also with the traditional healers groups, so that we join hands in addressing these problems and not leaving behind the departments that we're working together with, which is GDE and social development. So we have been working with them even before, even today in this implementation plan event that we had today.
Now, when working with the young people themselves, as well as faith-based organizations, what did you establish are the reasons behind the increase in pregnancy among these teens? Because many of us would have thought that life orientation provides some sort of a curriculum around sexual reproduction health education.
Oh, okay. We think there's things that make these young people to even fall pregnant. Some of the contributing factors are also including socioeconomic statuses, where these young people are from poor economic statuses, and some of them are thinking of making money. And then we also know that drugs and alcohol abuse is also linked to, causing teenage pregnancies, and also unprotected sex. If these young people indulge in unprotected sex, they also end up becoming pregnant. So ignorance also. We have noticed that ignorance is one of the factors that are causing them to end up being pregnant. Or even the gender-based violence that actually ends up with some of them becoming pregnant. So all those factors are some of the things that are making them to end up being pregnant.
All right. And then access to family planning, is that also among the reasons? Because ever so often when we speak to young people, particularly around Youth Month, they would say when they try to go to the clinics for family planning, they'd have some of the nurses judging them for their choices to be sexually active, whether they're still young, which speaks to the social cultural considerations that possibly need to be factored when putting together some sort of a comprehensive plan to deal with this.
Okay. That one of some of the young people that are saying, because of the way they are treated in clinics, they end up falling pregnant. The department is also looking at that, because we are also retraining our nurses on adolescent and youth-friendly services, and the importance of dealing with these young people in a friendly manner in order to promote access to our health facilities. And we are also advocating and educating these young people to, try and postpone or delay their first sexual debut up until later in life when they are matured. So with training, we are encouraging that our professional nurses in our facilities, we are even training the young professional nurses that we call the youth champions. We are having them in our youth-friendly services and youth zones in facilities, which are free spaces for young people to come into health facilities, and there they are even attended to by young nurses who will understand them and who will encourage them to live healthy lifestyles. And also those who have already started having sex, we are saying it's important to also practice healthy sexual practices.
Then, Ms. Mzondi, to the...
in our facilities.
Pardon me for interjecting there. Then to the plan itself that you unveiled today, talk us through it.
Okay. With the plan, actually it's focusing on three things. We are promoting advocacy. We are having the objectives. Those main objectives, they are three. There's advocacy. The other one is social behavioral change. And the other one is looking at programmatic areas. So with advocacy, we are mobilizing and soliciting support from the community, also from the youth themselves, from organizations, religious leaders, because we are aware that as a department, we cannot deal with this problem alone. That's why we've also included the parents, because in schools, we are having the school governing bodies, of which these are parents of these learners. So we want to work together with them in order for them also to assist us in, helping these young girls or even boys, because teenage pregnancy, it does not only involve a girl child only, but also a boy child. So we want to address both of them. And then the second objective is that we are going to address social behavior change. Social behavior change is also looking at health education in schools. So with this one, we are also having school health nurses that are visiting our schools, and together with the life orientation education educators, they are also addressing these young learners at an early age in order to, to educate them about the importance of even keeping themselves pure and also of delaying their first sexual debut, as I've indicated earlier. We also have centers of higher learning and education where we find youth who are out of school, who are in these tertiary institutions, and even those young people who are out of school, we are working with supporting partners, and those supporting partners are also assisting us. For example, we hold dialogues with these young people, either at school or at institutions of higher learning, dialogue on how teenage pregnancy can be prevented. Our Directorate of Communication, we also having the radio slots, we also having social media where they also share posters that are encouraging young people, to abstain or delay their first sexual debut, or also to come and visit our facilities whenever they would like to access contraceptives, because we're having different methods of contraceptives, injectable, oral pills. We also have long-acting, non-reversible, reversible contraceptives like the implants, like the intrauterine devices that they can get in our facilities. And for those who are sexually active, we are promoting dual use of contraceptive methods. Whether you are in any type of contraceptive method, we are also encouraging that it's important to also use a condom if you are sexually active, because if you do not, you might end up getting other sexually transmitted diseases.
All right,
and
Ms. Mzondi?
Working with the Department of... Pardon?
And Ms. Mzondi, unfortunately, we have run out of time, but indeed, it sounds like a very comprehensive plan. Hopefully, we can have you a bit longer at some point to talk us through some of the other elements of how you'll integrate this into society and work with the other sectors to address the scourge of teenage pregnancy. But thank you very much for your time this evening. That was Marousi Mzondi, Deputy Director of Gauteng Health's Integrated School Health Program, speaking to us.